Hello Whizzes! Welcome to my channel. Today's topic is neutrophil predominance. Neutrophil predominance, also known as neutrophilia, is a medical condition characterized by an abnormally high concentration of neutrophils in the blood. Neutrophils are a type of white blood cell, WBC, that plays a crucial role in the immune system's response to infections and inflammation. Neutrophilia can be indicative of various underlying medical conditions or physiological responses. Let's explore this phenomenon in more detail. Neutrophils. Neutrophils are a type of granulocyte, a category of white blood cells. They are the most abundant type of white blood cell and play a key role in the innate immune response. Their primary function is to phagocytize, engulf and digest, bacteria, fungi, and other foreign particles. They are often the first responders to infections and tissue damage. Neutrophils are short-lived cells, typically surviving for only a few hours to a few days in the bloodstream. Neutrophil count. The normal range for neutrophil counts in the blood can vary, but it typically falls between 2,000 and 7,500 neutrophils per microliter of blood. This range can vary slightly depending on the laboratory and population being tested. Causes of neutrophil predominance. Neutrophilia can occur for various reasons, including infections. Bacterial infections, especially acute ones, can lead to a rapid increase in neutrophils. This is a normal response of the immune system to combat the infection. Inflammatory conditions. Conditions like rheumatoid arthritis, inflammatory bowel disease, and vasculitis can cause chronic inflammation, leading to an elevated neutrophil count. Tissue injury. Trauma, surgery, burns, and other forms of tissue damage can trigger neutrophil recruitment to the injured area. Medications. Certain medications, such as corticosteroids, can induce neutrophilia as a side effect. Stress and exercise. Physiological stress, including physical exertion, can cause a temporary increase in neutrophil levels. Smoking. Smoking tobacco can lead to elevated neutrophil counts due to the inflammatory effects of smoking on the respiratory tract. Diagnosis and evaluation. Neutrophilia is typically diagnosed through a complete blood count, CBC, test. This test measures the absolute neutrophil count, ANC, and the percentage of neutrophils in the total white blood cell count. Further diagnostic tests may be necessary to identify the underlying cause of neutrophilia, such as additional blood tests, imaging studies, or tissue biopsies. Treatment. Treatment for neutrophilia focuses on addressing the underlying cause. For instance, antibiotics may be prescribed for bacterial infections, and anti-inflammatory medications may be used to manage chronic inflammatory conditions. In some cases, such as stress-induced neutrophilia, no specific treatment may be required, as the elevation in neutrophil levels is temporary and related to a specific trigger. Prognosis. The outlook for individuals with neutrophilia depends on the underlying cause. In many cases, neutrophilia is a normal response to an infection or injury and resolves once the underlying issue is addressed. Chronic conditions that cause neutrophilia may require ongoing management and monitoring. It's essential for individuals with a persistent elevation in neutrophil levels to consult a healthcare provider for a thorough evaluation and appropriate management. Understanding the cause of neutrophil predominance is crucial for effective treatment and overall health. If you like this video, please like, share and subscribe to my channel.